This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application, or you can click on the link in our show notes. Thank you.
All right, so little medical minute on a little peds topic. I think everyone's aware we're probably seeing a lot more sick kids or kind of viral illness type children, pediatric patients in the emergency department these days. So, pediatric vital signs, are frequently abnormal, and they're frequently abnormal at discharge. Kids are still either tachycardic or slightly febrile, and, question comes up, does that matter? So in adults, we try to kind of really pay attention to vital signs at discharge. It's been associated, abnormal vital signs at discharge are pretty associated with abnormal outcomes in adult patients, but there haven't really been good studies to show, does a kid going home with tachycardia mean they're going to be a bad outcome? So there was a study recently that looked at pediatric patients being discharged from 2 large pediatric emergency departments. They looked at, almost 100,000 pediatric visits and discharges, and what they tried to see is how many patients were discharged with abnormal vital signs, at least one abnormal vital sign based on normals for age, and then were that associated with kind of an increased bounce back rate or some adverse outcomes. So of the large number of almost 100,000 patients that were discharged, they showed that about 20% had at least one abnormal vital sign. So 1 in 5 kids was getting discharged with at least one abnormal vital sign. And then the rates of bounce backs or return visits at 48 hours compared with abnormal vital signs to normal vital signs was basically exactly the same, right around 2% for both. And they didn't see a dramatic increase in adverse outcomes or other bad outcomes or need for readmissions. So I think we're probably, just aware of this from seeing kids, they still are frequently tachycardic or a little bit febrile at discharge. And the most important thing, or the more important thing, is how do they look, documenting that they're taking PO and that they're, happy and playful and they don't look sick when they're being discharged, more so than a number. And if you really need to try and get a vital sign, sometimes better to put them on a monitor, maybe walk out of the room, leave them alone for a little bit, not try to torture them as we're trying to get vital signs because they're frequently abnormal. So, like I said, a lot of kids will probably have abnormal vitals, but make sure that they look good, that they're improved, they're heading in the right direction is probably more important than the actual number itself. Any questions, comments? Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.